All right, so what blood pressure numbers are considered emergency and when should you call 911? Have you noticed or have you taken your blood pressure and all of a sudden you saw numbers like 185, the top number, and the bottom number is like 125? You have no symptoms, you're in a panic mode, you don't know what to do. Should you take an extra medication or should you call 911 or should you drive yourself to the emergency department? Now, the question is very critical for a lot of people. They don't know what to do. So on today's video, we are going to look at what numbers are considered emergency and when should you call 911, when should you just call your doctor to get an advice over the phone, and when should you wait and see a physician the next day. Should you take your own medicines when the blood pressure is that high? So again, this is Dr. Moses. I'm going to discuss this topic with you today, and I want you to stick around with me to the end so you know what to do when you get these numbers. If you've not subscribed to our channel, please subscribe here and also give us a like to our videos, share these videos, and come back here so that together we can live a healthy lifestyle, especially after you turn 40. Now, before we dive into which numbers are considered very high in the emergency, let's look at what the normal blood pressure is according to the American Heart Association and also according to the American Academy of Family Physicians. Normal blood pressure is considered anything less than 120/80. That's according to the American Heart Association. And your blood pressure is considered elevated if the numbers are between 120 to 129, the top number, which is the systolic number, and then the bottom number is over 80. Now, you were considered to have stage 1 hypertension if your top number is between 130/139 and the bottom number is between 80 to 89. Stage 2 hypertension, according to the American Heart Association, is if the numbers are over 140 and the top number and the bottom one is over 90. So let's write the numbers down. We just went over the numbers. Again, the first one is normal, less than 120/80. Elevated high blood pressure between 120 to 129, top number, and over 80, the bottom number. Stage 1 hypertension between 130 to 139, and the bottom number 80 to 89. Stage 2 high blood pressure is anywhere over 140, the top number, and the bottom number over 90. So that's the American Heart Association. But according to the American Academy of Family Physicians, high blood pressure is considered hypertension if your numbers are over 140, top number, and the bottom number over 90 if you don't have any other comorbidities like diabetes or heart disease or kidney disease. Okay, so these are the numbers that you should have in mind. Now, what numbers should you not ignore? Now, anytime you check your blood pressure and you see a number like 180, the top number, and the bottom number is 120 or more, so 180 or more or 120 or more in the bottom number, this is considered hypertensive urgency if you have no symptoms. Okay, so if you have a number like that, you check your blood pressure, and get no numbers and you have no symptoms, the first thing I want you to do is do not panic. Okay, sit down still, quiet for about 5 minutes. Sit down with your back supported to the chair, your arms at the level of your heart. Make sure the cuff size you're using is the right cuff size, and then recheck your blood pressure again about 5 minutes later when you are very calm. Because sometimes just because you were up and down before you check your blood pressure, that could give you a false number. Or if you just went for a walk before you came back, or you just drank coffee before you took your blood pressure, those can get your numbers to be high. So make sure that you are calm. Okay, so and then recheck it again. Now, if you do check your blood pressure again and the numbers are that high, then there are a couple of things you need to do. Number one, do not pop in an extra pill, just, or a lot of more of your blood pressure pills you have to lower the numbers. This is especially if you have no symptoms, okay? So make sure that you call the nurse's advice line. Call them, they'll advise you, they'll look through the medications you have, they'll recommend which one to take, they'll get in contact with a physician on call to see which one you should take and which one you should not take, and especially if you have no symptoms at all. So this is what I'm talking about, you have no symptoms, okay? Now, if you live in a country where you have no direct contact to your physician or to the advice nurse, then if you have a blood pressure medications, maybe and your pulse is between 60 and 100, it's not high, it's not low, then maybe you can take an extra pill of your blood pressure medication. Then you can see your physician the next morning. Okay, go in and see your physician the next morning to maybe make an adjustment to your medications. This is when you have no symptoms. Now, what if you have any of these following symptoms? If your blood pressure is, the top number is over 180 and the bottom number is over 120, and you have any of these symptoms: number one, chest pain, shortness of breath, dizziness, blurry vision, any vision changes, you feel dizzy, you feel like you're going to faint, confusion, swelling in your leg, you can't breathe, if you a headache that is very uncommon for you, if you have any of these symptoms, this is considered hypertensive emergency, and you should call 911. Don't drive yourself to the ER, because this is telling you that you're having an organ damage, that your kidneys, your heart, your brain, your vessels. And so this is considered hypertensive emergency. Okay, so you should call 911, and a timely arrival will save your life. This is so important. If you live in a country where you have no 911 to call, there's no ambulance, then have a family member take you to the emergency department immediately, so that you can be attended to prevent further damage of your precious organs in your body. Now, what if your blood pressure is fine? You still is very high and you still feel fine. We already discussed that. That's what you should know. So what I want you to do is this. That this is a common mistake that I see people make all the time. And this is what they say. My blood pressure is high. I don't feel anything, so I'm not going to do anything about it. If you do that, what you're doing is that you are silently causing damage to your organs in your body. So what you need to do, like I said before, sit quietly, recheck it again, make sure the cuff size is okay, and then if it's fine, then go in the next day to see your physician to readjust your blood pressure medications. Now, the final take home is to know these numbers. Okay, 180 over 120. That is the danger zone. And the is divided into two wings. Do you have symptoms or you have no symptoms? If you have symptoms, call 911 immediately. If you have no symptoms, then call the advice line, or to help you, for your physician to help you adjust your medication doses. So those are the numbers that you should be aware of. Now, this is what I want you to do right now. I want you to write in the comments comment section. Have you taken your blood pressure, and what were the numbers, and what did you do when your numbers were very high? I want you to write in the comment section for the comment section for us, so that our readers will see how you reacted when your blood pressure was very high. Until then, I want you to subscribe to the channel, come back here. You and I are learning together to live a healthy lifestyle. Dr. Moses, I'll see you on the next video.